everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Clorazepate. Its brand name is Gen-Xene. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Clorazepate is classified as a benzodiazepine and has anti-anxiety as well as depressant effects on the central nervous system. In terms of indications for use, this medication is indicated to be used in the treatment of anxiety, as well as partial seizure disorder, and it can also be used to treat alcohol withdrawal syndrome. Now before somebody was to use Clorazepate, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to Clorazepate or any other component of the product, they would not be able to use this medication. And it also cannot be used in individuals who have acute narrow-angled glaucoma. Now in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to the elderly population as they would have a higher sensitivity to benzodiazepines, as well as impaired psychomotor function, which may cause falls, which could lead to fractures, as well as delirium. We should use this medication cautiously in patients who have a psychological potential for dependence. And we should avoid giving this medication with other CNS depressants. This medication may interfere with psychomotor performance, especially in activities that require a lot of attention, such as operating an automobile or operating heavy machinery. It should be noted that this medication should be avoided in pregnancy, and it should also be avoided in patients under the age of 9. And finally, withdrawal symptoms have been reported if the medication is stopped abruptly, so it's better to stop this medication slowly. Now once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Clorazepate, they can expect to receive their dose orally. So if somebody is using the immediate release formulation to treat anxiety, they would typically use 15 to 60 milligrams given in divided doses. The usual maintenance dose falls at 30 milligrams per day, again in divided doses. For a partial seizure, they may try 7.5 milligrams given 3 times daily. And the dose can then be increased by 7.5 milligrams each week up to a maximum dose of 90 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Clorazepate, so I'll go over some of those here now. Some patients may experience somnolence, and others may experience dry mouth while using this medication. Confusion and dizziness have both been reported. And some patients may experience slurred speech or a headache. That's all we're going to talk about today with Clorazepate. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.